My name is Eddie Orinda. I'm the Group CEO of Africa Trade and Investment Group, within which the Mazira Hospital and the Mazira Foundation fall. In this series of quarterly medical outreaches in partnership with the Compassionate Center for Families, Anaweza, WorldComp, and the Mazira Foundation, I'm excited about the social impact that we are creating within the communities. I mean, about a year ago, it would have been difficult to imagine that the Mazira Memorial Hospital will be having a fully functional endoscopy unit that so far has assisted more than 185 patients at a highly subsidized cost, most of them being widows from within the localities of Vihiga.
I am Faith Ngoha Odwaro, doctor by profession. I am the founder and managing trustee of the Mazira Foundation, as well as the managing director of the Mazira Memorial Hospital. Welcome to the Mazira Memorial Hospital, where today we're having our first medical outreach, having established the hospital. We have done this in the past before the hospital started, but now this was the very first inaugural medical outreach that we're doing, having completed the Mazira Memorial Hospital. And it was an amazing experience having partners joining us to have this medical outreach.
My name is Bethany Griggs, and I'm the director of Anaweza, which is a CBO based in Kisumu County. We're partnering with Mazira today to do an outreach for the community here in Vihiga County. But what we appreciate about what Mazira is doing is the work that they do with widows and providing health care for people who have a hard time accessing it. And so that's actually Anaweza's mission, is to provide health care to communities that lack access to health care. So whether it's in rural areas around the county, or whether it's people who are perhaps institutionalized in the remand home, the children's remand home in town, or Kodiaga, the prison. We take health care to populations that have a hard time accessing health care.
Kwa majina naitwa Fanisi Makungu. Nimefurahia hii matibabu. Wamenipima. Nimefurahi sana. Nataka hii wakujange hapa kila siku wakusaidie wamama, badala ya kuhangaika kuenda mbali. Sasa naomba tu wanisaidie. Wamenipatia madawa. Nimesikia mzuri.
Reverend Pastor Evans Kiranji Odwaro. I'm a pastor to PAG Church, and they have measured me, they have found out the truth, they have given me medicine, they have treated me, I have been injected 2 injections, and I have been coughing even when I came here. But since that time up to now, I have never had the cough coming.
Naitwa Lins Mrekani, niko Mazira Hospital kwa usaidizi wa mama. Kwanza nashukuru sana kwa hii usaidizi wanapatia wa mama wajane. Mimi binafsi, mama yangu amekuwa mgonjwa kwa muda mrefu, nimekuwa nikimpeleka mbale na hakuwa anapata usaidizi mzuri. Sababu hiyo usaidizi yako skini ya kutopata usaidizi mzuri ni kwa sababu ya uwezo. Hatukuwa na hiyo uwezo ile ya kuweza kumsaidia vizuri. Sasa vile nilipatana na Dr. Faith, nashukuru sana Dr. Faith. Vile hii outreach ilikuja Mazira. Sasa ikawa sasa nikuje kueleza mama akuje na waanze kumhudumia. Kuna wakati alikuwa na shida ya mgongo, akasaidiwa mshipi, anafunga mgongo. Kuna wakati hawezi tembea, akapewa kijiti ya kutembea.
Generally, the way I have found the things The doctors around have been very friendly, and so I want to encourage other doctors in other places to behave like that, because the way the doctors at Faith's place here behave and the way they exchange the things of treatment have given them 100%.
Kuna wakati dawa hatuwezi nunua, lakini tukikuja hapa tunapata dawa. Sasa kibinafsi mimi nashukuru sana sana sana.
Health is actually a human right, but when people are not able to access what they really need, despite the fact that they cannot pay for it, it makes me wonder if really it is their right to access the services. And because yes, they have that right, we as the Mazira Memorial Hospital, we have a philosophy of giving back to the community. And most of the time, as we do these medical outreaches, we're expecting probably people who are just curious to see what's happening here. But in our case, all these years, and particularly now that we have an endoscopy unit and a theater that are operational, we see that most of the patients who come are actually in need of these services. They are very sick. And I wonder if we were not here, what would have happened to the widow who comes with her little child who's very sick, or grandchild whose mother and father have also passed on, and the grandmother is not able to pay to access health services.
My name is Dr. Sharon Ocharo. I'm a pediatrician. I work in Kisumu County. I do volunteer with Mazira Foundation. I have come today and attended an outreach. I have seen approximately 10 children today, and has been quite interesting. I have seen children coming in with their grandmothers. I've only had one child coming with the mother. The children with grandmothers, most of them are orphans, and the few who have parents alive are not in the county. They are working outside of the county, and they are not directly responsible in taking care of the children. Only the grandmothers are. It has been a sad and happy day. Sad in that the toll on these grandmothers and these grandparents taking care of these children is really weighing on them. They're very old grandmothers whose primary livelihood is farming, so small-scale farming for their feeding. So taking care of these children and the primary needs of the children is really a challenge. So such an outreach has helped them come out to interact, to have their free medication. That is all they perceive about. And it has helped me do a diagnosis, send them for further investigations that needed to, and further follow-ups for the children that I'll be coming to see more often.
And how about the old man who doesn't work and is not able to take care of his financial needs when it comes to paying for these services? And clearly, most of them do need endoscopy. Most of them have very severe gastrointestinal pain that requires us to go in and find out what's really happening to them. So it really touches my heart to know that I'm giving them that opportunity to access a service that they would have otherwise not been able to.
And now venturing into therapeutic components of endoscopy, to begin pursuing procedures like polypectomy, stenting for people who have difficulties with swallowing and so on and so forth, banding, and indeed imaging that incorporates both ultrasound and X-ray, for which a lot of times we have to send patients, and the widows particularly, all the way to the referral hospital within Vihiga, that brings with it a lot of hidden costs. So I'm looking forward to a time when the Mazira Hospital can indeed have its own imaging unit that will then be infused together with the endoscopy procedures that we're already doing, in order to have a more holistic approach to the therapy that is much needed among the needy patients that we see every day.
I'm Kadenyi Elizabeth from Goibei Mission Hospital. I came here to volunteer over here. So far I've handled about 5 patients. Yeah, I've handled 5 patients with different clinical presentations. So it's a nice experience for me. I'm very pleased with the experience I've got here. I've got interaction with the other doctors. It's all very calm and cool. The patient interaction has been very involving and a great one.
It is actually paramount to volunteer for these services. It is one of the cornerstones of giving back to humanity. Let's get out there, let's do outreaches, not only the healthcare workers, any other fields. There are children who are orphaned would need the medical, legal, the social workers. All, it is okay to volunteer, it is right to volunteer and give back to them, so that their journey as they are growing up as children, they have what their rights need to be, they are all fulfilled. They go through life as any other child would have gone through life.
We as an organization, Anaweza, really appreciate partnering with other organizations, because we believe that if you want to go far, you go together. And so it's been a real joy to be able to partner with Mazira.
We have begun meeting the global surgery goals, which basically encompass making this kind of procedures, and especially the surgical diseases, more accessible, affordable, and timely for those who really need them within the communities.
Yeah, we see Dr. Faith being able to fill in some of our gaps when we meet patients who need extended care beyond the basic treatment that we offer. Dr. Faith is able to do general surgeries for general cases, whether that's lipomas or whether it's goiters or removing masses in different places. You know, people suffer from easily preventable medical maladies or illnesses or diseases. And so sometimes people can live with these difficulties for years. And so to have a partner that recognizes, like, oh, this person is suffering from this thing because they haven't been able to afford health care, and what can I do to step in and help make their life a little bit better?
As we do this screening, we also sensitize them on the need for early diagnosis, because our experience has been at the foundation and at the hospital that most of the times when we see patients and when we do endoscopy, it's usually too late to do anything for them. They come when it's already cancer, and not even just the first stage. Most of the time it's the second or third stage. And that really is concerning to me as a doctor and to us as a foundation and a hospital. And because of that, we have taken a big step. I call it a big step of faith because health is very expensive, but we are sacrificing together with many friends and partners to be able to do this on a more regular basis.
And it is this sort of quarterly outreaches that are going to help us do effective screening and identify the patients that are in dire need of this kind of intervention. So I'd like to still appeal to all the well-wishers out there and to be thankful indeed for those who've already walked with us this journey.
Every quarter we are going to be having a medical outreach at the Mazira Memorial Hospital, targeting not only the widows but also their households and the community that they come from, because health is a community problem. And I'm calling out to all of you, viewers and listeners, that you will join us in one way or another by giving your time, your expertise, a word of advice, and also your networks that we can tap into to be able to sustain what we are doing at the Mazira Memorial Hospital. Thank you so much.